excited about this topic. And so thank you everyone for joining. I think we've got a good enough size group to really make this a interactive session. So yeah, I'm just excited for a conversation. And yeah, without further ado, Madison, are you also excited?
Absolutely. Very excited to be in community with all of you today. So thank you for joining us. I'll start us off by just going over a bit of what you can expect for us to cover today, and also some introductions. Sierra, thank you for kicking us off. But as she said, I'm currently a student, a doctoral student at UNC Chapel Hill, and a health policy research scholar at Robert Wood Johnson Foundation. My background's in biomedical engineering and clinical psychology, and my current work focuses in the domain of digital mental health. And so I'm interested in ways we can use technology to improve mental health and well-being for minoritized and historically excluded communities, historically excluded youth and their families. And in that, I'm particularly interested in the development of equity-centered design and implementation strategies that can improve both scalability, accessibility, and effectiveness of digital mental health. And so, Ime, did you want to add anything about kind of the work that you do?
Thank you. Yeah, I'll also a brief add-on to that introduction. So yes, as Sierra said, founding director for the Upswing Fund, and excited for this next chapter of Upswing. But even prior to that, just as it relates to digital health, I had really bad anxiety and OCD as a teenager, and way back when wasn't able to find anything online to help me in my time of need. And so in 2006, when I was 16, I started anxietyinteens.com, the first 14 by teen online resource, and have been really passionate about how the internet, digital solutions can help expand access to mental health, substance use services for youth and adults ever since. So I've always been very excited about this topic. So yeah, a little more about what you can expect from our conversation today, but I want to jump in to see who else is here with us. So, question. If everyone can please write in chat your name, title, organization that you're coming from, and last but not least, very first concert. So, who do we have here? Come on, don't be shy. I'm gonna get the tunes back up to rev your memory. Red, nice.
Oh, I'm seeing
Kiss,
good.
very cool. Mark, Beyonce that's great. Oh my gosh, that's like that. Talk about a high bar. How do you go to a conference, concert after that? Ryan from the Trevor Project. Oh yeah, Erica Badu. Okay, no doubt. Oh man, deep cuts. Those were the days. Jason Aldean.
Yeah.
A little country playlist here or there. Some cool. Oh, Panic at the Disco. Yes.
Oh, nice.
Cool. Well, if you can't tell from the slide, Spice Girls was my first concert. And yeah, looking forward to going to more now that COVID is over. Or COVID is over. My gosh, COVID is hopefully dying down. Hardly over, as many of you are experiencing. Okay. So let me go ahead and just do a little bit of, speaking of COVID, what has happened as it relates to digital mental health solutions through the pandemic. As many of you have experienced firsthand with your organizations, you've seen that telehealth has proliferated through COVID, when teletherapy specifically was in single-digit use pre-pandemic. It shot up to 60, 70, 80, 90%. But what's intriguing for the mental health subset of all conditions that went to teletherapy or telehealth, mental health has continued pretty much at post-pandemic levels, a lot of payers have said. So while a lot of other physical conditions have gone back to in-person appointments, telehealth for behavioral health conditions has persisted still. I think a lot of the payers, Cigna, Aetna, a few of them, Humana, had reports consistent to around like 60% utilization, even now 21, 22. So yeah, continued telehealth use, but then that also means a proliferation of digital mental health startups have sprouted out, received funding, VC funding, really at record levels in 2020, 2021. That has cooled off quite a bit starting Q1, Q2 of 2022. So you've probably seen the press releases for even various youth mental health startups like Brightline, Equip's another one, that were raising tens of millions of dollars for their solutions from venture capitalists to expand. That's interesting for our use case here because some community-based organizations might say that, oh, this is great, it could augment our staffing shortage issues by having this virtual solution when we're in communities where we can't recruit local providers. But, and I'd like to ask you more of this once we get to our Jamboard exercise, others see it as potential competition from clients as well as competing for providers and employees. And so the other thing, I'm going a little out of order here, but one thing that I definitely think we'll see continuing to happen even more so in 2022 is consolidation. So a lot of these startups raised a lot of money, like I said, last 2 years, but then, the outcomes haven't really panned out for many of them. And a lot of them are at their next, or they would like to be at their next round of funding, but they're struggling to either raise the capital or sell to customers because it's just the space is so crowded, and a lot of buyers in the which include health plans on the commercial market, Medicaid, Medicare, public sector side, employers are saying, we're so tired of these point solutions. We're looking for just one platform to fit as many of our needs as we can. So I think we're going to see some consolidation of many of these point solution startups ending up at 1, 2, 3 platforms. Let me pause there. Any questions so far? I know that was a lot. Feel free to comment anytime, jump in. I think we have a small enough group that if you want to go off mute, that works too. But if not, I'll continue and hand it over to Madison for why is any of this stuff even relevant for CBOs?
I'll give another moment in case someone did have a question. Okay, so why are digital technologies relevant for organizations that are targeting youth mental health and well-being? Well, first thing is that we know that youth are navigating digital spaces more frequently and at younger ages than in previous generations. A recent 2022 Pew study found that 95% of teens in the US between the ages of 13 and 17, I believe it was, reported having access to a smartphone device, and 90% reported access to a computer. And on top of that, almost all teens in the study reported using the internet daily at around 97%. And so looking at the landscape as a whole, there's a large percentage of youth with both access to a technology device and internet connection, though it is important to be mindful that there's disparities to be cognizant of that we'll talk about a little bit later. And then second, there's been research evidence supporting the use of digital tools to support youth mental health and service delivery, much of which was catalyzed by the exacerbation of barriers to care associated with COVID, as Solome mentioned. And so We'll talk about some specific tools at the end of the presentation today, but if you know of any that may be of interest to this group, we welcome you to share those resources in the chat throughout this talk as well. Now, moving on to, oh, I'm sorry, previous slide. Sorry about that. Moving on to the benefits for organizations, Upswing released a report earlier this year that detailed some of the challenges facing community organizations of providing culturally responsive care. And a few of the things noted included, shortage of providers, especially minoritized providers, as well as other organizational challenges like workforce development and training and administrative support. I won't go too in detail about all of those things specifically, but I do highly recommend taking a peek if you haven't already, and I'll put that link in the chat too now, just so this is available. And so considering all of those challenges, work has shown that integrating digital technologies is one approach to potentially scale and sustain services, all of which point to digital tools as being a potentially meaningful addition to community organizations who are providing mental health services for you. Next slide. All right, so how can we use these tools? And while there are levels to technology integration in community organizations with potentially infinite combinations, but they can be thought of to exist on this spectrum of tools that are used to provide organizational support, tools that provide adjunct service delivery, and finally tools that are providing comprehensive service delivery. And so starting on the far left at the lowest level is organizational support. And these are technologies used to streamline or support capacity and operations in community-based organizations. And some of these tools you may already be using. And so, for example, using like online surveys to collect information about youth using your services, or who are interested in using your services. You could also be using these tools to identify which services may be most useful for each person, or to tailor personalized services based on either an initial assessment or over time after routine assessments of how youth are doing while they're using your services. Other examples of this would be using tools to manage services, recruit staff for onboarding and training. And so for cultural responsiveness in particular, there are digital learning resources such as Violet, which is a paid program that focuses on credentialing and workforce development in the domain of cultural competence. There are also free digital learning resources through academic institutions and government organizations that you might find useful for staff who need introductions to this topic or are just interested in exploring more. And so I'm going to add some of those resources to the chat now, and would be happy to talk more about them too. And so I'll just go ahead and, oh, I see some more introductions. Welcome. And so I'm adding those tools in. One of them is called Project Ready, is Reimagining Equity and Access for Diverse Youth, which is hosted by the University of North Carolina at Chapel Hill. And it focuses on thinking about anti-racism work in mental health care, providing some actionable tools and guidelines. There's also another, the final two that I put in the chat are both by the University of Wisconsin-Madison. There's some content in there that's Wisconsin specific, but a lot of it is pretty general, and they're self-paced where you have some check-ins, some check-in activities you can do. You can also pause and come back to access those resources later. And so while organizational supports are more what's going on in the back end for the other two here, we're thinking about how technology can be used to provide supplemental or comprehensive direct care for youth. And so these would be supports that are like delivering therapy via telehealth or doing, CBT through a mobile app. And so for these types of technologies, we'll talk about some specifics that are available that are also free to use at the end.
Welcome, our new additions, everyone. Cool. So thanks so much, Madison. If I understood correctly, you covered the fact that youth are online. So there's an opportunity to meet them where they're at. And they are looking for help online. Like, let's face the facts that they're searching for things on TikTok, Instagram, and sometimes they're not finding the best things. And so this is an opportunity for us. Also on the organizational side, I can't think of one grantee who hasn't said that we've struggled with finding, retaining, recruiting culturally sensitive youth specialized staff. Perhaps there's an opportunity for technology to augment there. And you had a great summary for the different ways tech could facilitate support for CBOs. But now I really want to hear from our audience. So we're going to mosey over to a Jamboard. But before I do that, Sierra, would you help us in delivering this poll? So you should see something pop up on the screen. We'd like to know, have you previously even sought out or used digital tools in your organization yet? Because I definitely want to know, hear stories from the audience, or if this is even your first foray, also something that we can discuss on our Jamboard next. So we'll give a few minutes for that. I'm not fast enough to kick up my playlist. So by the time I get our music back, I think the poll will be over. Okay, everyone responded? What do you think, Sierra? You ready? All right, let's see. Okay, look at that. That's more than I even expected. Neat. Almost 80% of attendees here have used digital tools in their organization, and yet 20% haven't for some reason or another, which now I want to get into. Okay, so we're going to move over to this very collaborative Jamboard tool. Let me put the link in the chat here so everyone can access it. Are folks familiar with how to use Jamboard? If not, I want to just start from left to right to talk about what have each of our experiences been at our respective organizations using digital tools. So let me do an example of a sticky note. So everyone on the left-hand sidebar, we've got click the sticky note icon, and that's where you'll be able to type. So let's start with this first question. We're going to take the first few minutes to address this first one. What exactly have you tried for those 80% who said they have used digital tools? Or what would you want to try for the 20% who said we have not yet? So I'm going to go and do a sample. You can pick any color you want. I just ask that you put your initials in the last as you close out the note, if you're comfortable with that. So I'm going to say, we have used Headspace at our org. Offered it to youth as a post-program solution, ST. Okay. Perfect. All right, everyone comfortable? And then it's going to get a little crowded, but yeah, fabulous. I'll keep moving them down here so there's room. Let's see, I think I saw Fred in here, and no, he's quite digitally savvy. So I'm going to be picking on you in your experience. Who else do I know has used digital tools? Okay, let's start reading these. Cool, yep. Using Outlook and Teams. Yeah, Google Classroom, awesome. Okay, adding digital curriculum. Yep, holding our group-based peer support programming on Zoom. That's, I mean, a lot of folks are familiar with that, easy to use. Ooh, Trello. I love Trello. I forgot about Trello. Yes, I need Trello in my life. I was very organized when I used it, but no longer. Neat. This me. Ooh, what is that? I'm going to ask whoever put that one down.
Sorry, I should put more details in that. Is that okay? It's kind of long to explain on a post-it though. So it's just a digital, it's almost like making a website or like a link tree. I've used link tree as well, but this is a little bit more elaborate. So it's like somewhere between a website and a link tree where you can animate things and put videos. And it's like it's like a fancy but phone friendly way to make a newsletter. So
Interesting. Okay, we definitely will share this document with folks afterward for all these great ideas. And Jennifer, just for so folks can be familiar, what organization and what's the population that you're using the tools with? Age group and
sure. So I'm with Powerful Voices, which is a nonprofit that works with BIPOC and gender expansive girls and youth. And so I am usually working anywhere from like middle school to high school and some post high school, like in between college or like first couple of years of college. So yeah.
Awesome. And yeah, I know we're not on the next topic yet because I still see a few more posts rolling in, but yeah, were the youth pretty receptive to it? Were they comfortable using the technology?
Yes, they actually really liked it because there were animations in it. So that was usually like an incentive to keep scrolling because you can, instead of going wide or smaller, you can scroll. And that was pretty user friendly. And then it was nice to be able to just have ongoing contact info for me at the very bottom, which was nice.
Fabulous. Yeah, I'll for the sake of time, I want to, if folks want to start brainstorming on our second column, we can scooch some of these over here to make room. What benefits have you noticed so far from the tools that you have implemented? We can get started on that column, but hopefully if we can multitask a little here, I'd love to ask AJ, could you talk a little bit about the Discord servers? This is super intriguing over here. Let's see. We might have lost AJ.
I'm here. I'm sorry. I have a very upset puppy.
Oh,
and so I'm having to move. But yeah, I work at the LGBTQ Center in Las Vegas. And we work with an organization called CenterLink, which links all the centers around the nation. And they have their Q Chat space program, which is a Discord server. So you open it up at certain times. It's monitored by adults. And we were able to engage youth that way. During the pandemic, I thought being the youth programs manager, I was like, oh, we're going to have meetings on Zoom and everybody's going to come and ours is going to be the most successful program. And that was not the case. It was really astounding to see how much our youth still need that personal connection. But we had to do what we had to do. And so Discord was a way to, belay kind of the Zoom fatigue and people could still connect in a different kind of way. The drawback to that is that it's like it can be overwhelming to continue on that schedule all the time because they still, even though we're back meeting in person, like they still want that Discord server. And so we have a leadership team, and one of the youth in our leadership team has offered to moderate that space.
Wow.
And so I'm hesitant about that, but also want to empower them. And I feel like they're, you know, trustworthy enough to, you know, let us know if anything's going on that we need to know about, but also be fair in that space. So we're going to try that out pretty soon.
Oh, wow, AJ, thank you. This was such a great use case. I mean, you touched on everything from meeting youth where they already are to offering this leadership opportunity for them to actually facilitate. Really, really neat. And I'm glad you mentioned, so Centerlink is also an Upswing Fund grantee. And we even have a learning session with them coming up. Let's see, Sierra, October
14th.
14th, yes. So absolutely would welcome everyone to come attend. They've developed some wonderful tools. Huge fans of Ime, one of their applications. I think we have an Ime here. Are folks familiar with the Ime Solution? I could do my best. I know I won't do them justice explaining. It was a partnership with Hope Labs, Centerlink, and oh man, I think there's another group, but it's a online digital tool specifically made for LGBTQ youth to have a tailored, I would even say they disseminate some online CBT, things to manage emotions, but it's the content, the design, everything is really tailored for LGBTQ youth and free to use. It's going to be on our resources slide later. So excited for people to learn more about that. Okay, how are we doing on any other benefits? Let's see. Okay, oh my gosh, forgot my glasses here. I'm gonna look for some more examples and then ask people about benefits. Who did Trello? I would love to know how you were using Trello in your organization.
Yeah, sure. That was me. We use it for a lot of like long-term project planning. So a lot of like upcoming dates and like sharing between different staff members. So it's more of like not using it directly with youth, but more to supplement the project planning for work with youth and like longer term.
Great, I see. And that was Susanna. Thank you. Well, which is interesting because, you know, we've focused a lot of this presentation conversation on clinical tools that could actually be, you could offer to youth as a extension or augmentation to your programs. But there is a plethora of new mental health technologies and startups that are aimed at optimizing the administrative side of running an organization or measurement and quality monitoring. For example, there's a whole bunch of voice AI apps that have come out on the market that are, you know, depending on how some are comfortable with this yet, maybe it's a bit novel for more than others. They're listening with consents, of course, listening to actual therapeutic sessions and evaluating our clinicians conducting sessions with empathy and following modalities that they said they would to, or can they detect on the client side, are they perhaps having some language that might indicate suicidal ideation? So it's getting pretty Jetsons. Oh yes, using GIFs. Oh my gosh, fabulous. I've got more in the chat here. Let's see. Yes, please come to that October 14th meeting. That's going to be great. What else have we got? There's so many good ideas here, and I'm simultaneously trying to make sure we're looking at the clock. Right, the geography thing. See, I don't know who posted this green one, but that is, I can imagine, is such a huge issue for so many of our organizations. Let's see, gifts in online surveys. Wait a minute, I didn't even finish that. Okay, that's cool. I need to switch from SurveyMonkey, apparently. Anyone else have any examples of how you've used tech as an extension to maybe not only the youth, but caregivers as well? Hinting, wink, wink, Fred. Not to put you on the spot.
I mean, I'll just say it's faster, but with caregivers, their schedules are so busy and they're caring for so many people, so that just like with you, the asynchronous connection, and then really focusing on the ongoing journey. So not a single crisis text point, but making sure that they're on the journey, because they have so many questions ongoing that build on each other. But it's remarkably similar in terms of the experiences of young people and caregivers. They need different things at different times, but sort of the active ingredients of low effort, salience, ongoing connection is really there. I do agree that one of the things we've learned, just as someone, is using pictures and videos in assessments increases engagement for sure. And it's something that I think more people are doing, that I've seen in its Typeform and other tools, that have been mentioned. I think SurveyMonkey might have it now too. Real opportunity for further engagement of ongoing assessment, which we found is incredibly low in terms of people who are willing to do it. But it's a great idea. I'm glad someone brought it up.
That's, yeah, these simple things that could increase the engagement. That's huge. Wonderful.
And then, the other thing you can do is you can tailor to demographics in terms of what shows up through just basic branching. If you can get demographic information that is helpful, that increases engagement significantly. So for young people in particular, a young person, a picture of a young person, for example.
Wonderful examples. Well, yes, we'll please feel free, if you are thinking of any more ideas, you can still post on the other columns, but why don't we segue over into challenges? And I won't steal Madison's thunder, because I know that's we're talking about that next, but would love to hear a little more on any concerns, maybe the 20% of folks who said that you've not yet tried digital tools for your communities. Why is that? Or what questions might you have? Let's start posting them over on this one. And again, just a refresher, to make a sticky, you just go to the left hand and you can say, yeah. Right. About training support, for example. And then we can move it over here too. Oh yeah, provider adoption and support, for sure. That's a common one that I think we hear a lot. I'll give a few moments for everyone to do that. Maybe I'll be fast enough to get our brainstorming music on. Confidentiality. It's a great one. Sorry, stole somebody's post-it. You just want to go back in person. Right. How to access them, of course. Cybersecurity, it's a big one. Okay, Pharrell, we gotta go. All right, let's start. Yeah, please feel free. The ideas are great. Keep them coming, but let's see if we can talk about a few of them. Let's see, let me go with this one. It's easy to learn Canva and Visme platforms, but there is a lot you can do, which can be overwhelming at first. that's great. That's, I mean, there's so many apps. It's like, how to even get started is half the battle. That's a really good point. Let's see. Learning new technologies and getting confident in using them presented a bit of a challenge at the beginning. Oh, but YouTube University is your friend. Yes, that's great. What else do we have here? Yeah, that's great. Let's see. Who's our Trevor project contact? Let me see. I can't see the full screen. So yeah, do you want to say a little bit about that?
Recently, yeah. So my name is Ryan Early, he, him pronouns. I'm the Senior Grants Associate for the Foundation and the Government Grants team at Trevor. Over about 2 weeks ago, we had like 4chan attacks on several of our platforms, which increased a lot of the wait times for youth seeking interventions or crisis counselors. And so our system was flooded and more of the youth had to wait longer. So we're reaching out for additional funding for cybersecurity as well. So yeah.
Oh, it's really frustrating.
We experienced that in our Zoom infiltration in the very beginning and had to add passwords and stuff, and it sucks. I'm so sorry.
Yeah, and I think once these get more publicized, youth may be reticent to reach out as well. So that can also hinder folks asking for, help or anything too. So trying to minimize or eliminate those attacks is really our priority at the moment.
That could definitely diminish trust. So, lack of personalization. Does anyone want to speak to that a little? That's certainly a huge theme that comes up.
Hey, I said that it's just as a, the more we can really speak to individuals and celebrate the differences that we have, it just increases respect and engagement and the connection that we make. And, we just realize the more we do it, it doesn't always necessarily improve actual outcomes when we look at the data, but people are more engaged and overall happier. Like they're just so, and it can be hard to do. It takes a lot of work, but it seems really, really worth it.
Yeah, really well said. And then, yeah, this access one, how can we not talk about this from, everything to where to get started to knowing which ones to offer. Some of them, most come at a cost. And yeah, is it some of them are organization or B2B businesses that you can offer for free to clients, but then some of them are direct to consumer, and how do you support the cost of that? Yeah, anyone else, whoever wrote this one, if you had anything else in mind with access, let me know. Or if I covered them. Thank you. Yeah, lots of good, maybe this is a good segue. I mean, we covered some important concerns, but yeah, I mean, still this space is so nascent and we need to keep evolving it. And Madison, maybe I'll hand it over to you to talk a little bit about, where do we need to go still, or some concerns that might not have come up.
Absolutely. Well, first, everyone, thank you for sharing your thoughts and joining in on the conversation. A lot of the things that were mentioned are some of the most common challenges for community organizations that are interested in integrating tech into their services. And I'll talk briefly about those. And there's also some others that you all brought up that aren't mentioned here. And so I think it's great to have had a space to think more about what those looks like, and also to see how innovative you all have been in terms of what you're integrating and how that's looked for you in your organization. So thanks again for sharing. So 3 things I did want to talk a little bit more about in the context of the conversation around cultural responsive care and the potential for implementing digital technologies to better support that. And the first is utility. And so as Solome mentioned earlier, the proliferation of digital health products and tools that has been exponential over the past couple of years, and especially over the past decade. But we do have some evidence that the majority of tools that are available to use for direct care, at least, are not clinically evaluated and oftentimes are not developed by or with even consideration to the unique experience of youth for minoritized communities. And so that is all to say that they may not fully represent the diversity of communities that you serve. And this issue can be impacted both by digital inequities and health inequities that are interconnected and both reinforced by longstanding systems of oppression and structural barriers. So if you found you found that it's challenging to sustain or scale services to whatever your target group is in your organization, and you've done a bit of that needs assessment and are considering using digital tools, getting a sense for the potential utility may be helpful, and some of the questions that you may be asking at that point may be how the technology or either was or will be developed. And so was it developed with diverse youth participating in the process? I think I saw a comment about that someone mentioned, is that being essential. And I think something that someone else may have mentioned was around the measurement factors, like is the impact of using the technology measurable, and is there evidence to suggest that it would be effective and not harmful? And I think maybe the last thing there is thinking about what structural and personal barriers might be, what those barriers might be to youth who are engaging with a particular tool and how you might address them. And someone brought up this idea of the customization, the personalization. How are you getting the right tool to the right person who needs it when they need it? And so there's some really great free resources, one of which I think is in a future slide, that talk about some of the tools that are available out there. One is One Mind Cyber Guide, which is like a it's like a repository of digital health tools, where they have done some of the evaluation on the back end. It can provide a bit of a synopsis about what types of tools are available, how might that tool rank in terms of efficacy or access and things like that. And so it provides some context around that. I thought I had the link here, but I don't. But there's another tool that I can add to the slide deck before it goes out, just at the end. That is another way of another framework for evaluating the types of tools if you're using them for direct care. That may be helpful to have in your back pocket as you start thinking about some of these things, or as you continue to think about these things. And so this kind of leads us to the next piece on infrastructure. And here the focus is on attention to disparities in access and use. So as an example, digital tools that require devices compatible with a certain operating system, like for instance, this mobile app needing to be compatible with Android or Apple iOS, that requires youth access to a smartphone or a tablet in particular. And so thinking about what are disparities in access to those specific things would be an important consideration for that. And then along those same lines, determining which tools may be most appropriate for your services may also be informed by the type of sources, like social media or mobile apps or podcasts, or any number of things that youth prefer, and that they prefer with engaging with whatever type of content that you're providing as a part of your service. And so both whether they prefer engaging with that particular source, as well as how frequently they typically do, may be important for thinking about, if you have a service that needs to be optimized for everyday use, then you might be thinking, oh, this is going to be suitable for a particular type of source, say social media. If you've surveyed the youth and they're using Instagram daily, so having that as an option for them to engage with frequently, and then by extension, knowing that that would require access to a specific type of technology device through which you can have access to that social media platform, for example. And so what we know so far about this with youth, interestingly, is the same Pew study that I mentioned earlier found that about half of teens say that they use the internet almost constantly, and so more than several times per day, which is nearly double the number of adolescents who said the same thing in 2014. And so when breaking those numbers down across racial and ethnic groups, for example, they found that Black and Hispanic teens were more likely than white teens to say that they were online more frequently. However, we also know that there's additional evidence that suggests Black and Hispanic families are less likely to have access to a computer device and high-speed internet and broadband access at home. And so that may suggest that there's potentially more inconsistency in access across time. So when thinking about longevity of care, that might be something that's considered, that might be a consideration when thinking about the usability of a particular tool. And I'll say that the existing work does not do nearly enough to capture the nuance that exists, one, at the national scale and also within your specific communities, especially as we think about barriers to access across and within minoritized groups. And so, you know, it may be interesting to or helpful to survey your specific community. So one, thinking about, you know, if there are local community or government sponsored technology loan and borrowing programs, which we have a few here in North Carolina that allow folks to acquire technology devices for a specific amount of time. And you could use those devices to deliver services if you're a nonprofit. There's also many free tools that companies will distribute for free to nonprofits as well. I know Canva is one, I believe someone mentioned Canva as a tool that they use. Microsoft and Google also have some free tools for use by nonprofits. And then also, if there's a process through which you are introducing youth to your services, you may find it useful to collect some general information about their access to tech, the internet, you know, how often they use it, and if they're comfortable using it, accessing resources on their device that are specific to the types of services that you provide. And I'll pause there to see if anyone has questions about anything that I said before I kind of go more into corporate responsiveness and
Yeah. Can I jump in, Madison? When you said
Yeah.
Canva, like this generation, man, I hired a Gen Z, a new Gen Z age associate, and asked her to help create a presentation. And I mean, I would have expected PowerPoint, but she didn't even have the PowerPoint app. She's like, oh, here it is on Canva. I'm like, Canva? This is what kids are learning these days? Man. Anyway, that stood out to me.
No, absolutely. It kind of took I'll say it seems like it took everything by storm as you're seeing Canva everywhere. And so definitely one of those tools that I'm finding they do, I believe, have a program where you can get access to the premium version and apply to have that if you're a nonprofit for free of charge. And so I think someone else mentioned that in the chat too, of checking to see like what are those opportunities that may be available. And then the last question that I think I added at the end there that was talking a little bit about comfortability and why that's so important is, especially when we're talking about cultural responsiveness, we know that there's been a history of misuse of information in healthcare and institutional harm. So when considering tools, thinking about the data security, which I think someone brought up when thinking about like, what does that look like with Zoom, things like that, which I know became a big issue, especially at the height of the pandemic. But thinking about data security and privacy settings as being an important part of that. And so in that, it might be thinking about what information are you or potentially a third party is collecting, and could that data be used to cause harm? So like, what information are you collecting? How long do you have access to that data? How is it stored? And things like that. And And there's also a consideration of whether youth have their own device or if they're sharing a device. And so, I think, for example, if someone is part of a peer support group for LGBTQ youth, for example, but have not shared that with other people in their family, then using a shared device in which data is stored on that device may be an issue. And so, the note there is thinking about how you might better match, or think about how can you match tools with particular use, tools for use with youth that will benefit from them, but then also to protect them from potential harm from that. And so then the last note that I'll say on this is that so many of these issues are interconnected. And so, for instance, this lack of access to broadband and that more infrastructure issue that I talked about earlier could also be something that requires you to use public Wi-Fi or a prepaid plan. And we know that those leave folks at greater risk of privacy breaches as well, and of having their information misused. And so there's also this idea of is there a safe space for them, one, thinking about the external environment, but then also the digital environment for them to be able to engage with services that are provided through a digital means. So I'll say and summarize here is that we can get to some helpful resources that Solome will talk about. But in summary, when interested in thinking about integrating some of these technologies into workflows and services, some of the things that may be helpful to consider, thinking about how you might optimize effectiveness. So thinking, which commercial devices and sources have the necessary features and functions that I need to achieve whatever the goal is I identified, if that's scale, if that's recruitment, whatever that may be. Thinking about scalability. So what are the adoption rates and trends in use of this particular tool, especially for historically excluded communities, which are a focus of this talk today, and thinking more about culturally responsive care. And then lastly, thinking about sustainability. So how acceptable or usable is the tool to youth and for your organization to maintain. I think I saw a comment about, technology still has to be integrated in, which means there's some workflow changes that may happen, and there's some training that needs to happen, and all of those different things, where YouTube University is, of course, an option, I think, as someone mentioned, but there may be some other kind of startup organizational costs that are associated with that. And so thinking about whether there's capacity to integrate and to maintain that particular tool. And so I think the last thing I'll say there is, and someone brought this up, the importance of, again, centering and involving youth in the community in this process of identifying what's being used, and constantly kind of bringing them into those conversations about what's working, what's not working, how might this look differently. And with all that in mind, I'll pass it to Solome to talk about some free digital tools that may be helpful to the communities that you're serving.
Yes, so well said. You covered a lot, Madison. And the chat is popping off. Good comments here. Talked about, yes, getting the next generation using the new age tools. Oh my gosh, when did I get so old? User friendly. I mean, that's the thing for app developers now. In the bar for healthcare technology user experience has been so low historically, but as healthcare becomes more consumerized and the next generation uses more and more tech, their bar for UI UX is just so much higher, and they're used to, they don't want some Minesweeper level app. They're like, oh, World of Warcraft, or it's a new world. So higher expectations on app designers and developers. Which, speaking of which, here's a few that we discussed today that are free and available for CBOs to seek out, offer to your clients. As we said earlier, the Ime presentation is going to be October 14th. Just some really great nonprofits that have helped develop that application, and I've had the pleasure of meeting with not only the adults but the youth who helped co-design the whole thing. I'm really impressed with that app. Some of even our own grantees we've helped support the expansion and development of their own digital tools that are free and available for all youth online. Project Yes, for example, from the Lab for Scalable Mental Health, has tools for youth to access single session interventions and other online CBT resources. Same with Nod for youth who are experiencing loneliness, in partnership with Hope Lab. That's a great, really well-designed app to help address social isolation and loneliness in youth. We've had, let's see, Ryan, where are you? He might do a better job of explaining all of the amazing solutions that Trevor Project has available.
Yeah.
Not to put you on the spot, but
no, it's fine. So yeah, we have Trevor Space, which is our in-house built social media platform for LGBTQ youth around the world, the English-speaking world, I should say. We also have Trevor Chat, which is either instant messaging help, or we can also do like normal SMS chat. And then we have Trevor Lifeline, which is our original flagship sort of platform that we use, and you can just use it via phone. So yeah, we have 3 different ways.
Perfect. All sorts of modalities, optionality for youth to access, support the way that they prefer it is, I think, just amazing and ideal. So thanks to Trevor Project for those solutions. Peer Health Exchange has their Self-See app. The Not Okay was developed by 2 high schoolers themselves. And then, yeah, I think we're running out of time. Oh my gosh, where did the time go? But here are some other organizations that support the development, funding, and dissemination of a lot of these free tools that we discussed. And I think, Madison, you had mentioned Cyber Guide as a place to read up on and get an understanding of what's the efficacy of many of the free apps out there, because there's a lot of them.